Hi everyone. I hope that you can hear me and that we have at least a couple of people joining us here now. Welcome to this evening's webinar from the Global Human Rights Group. Thank you so much for joining me. So my name is Claire Mann and I'm the Director of the Global Human Rights Group. And this is the beginning of what we hope will be a successful series of monthly discussion hours. Today's going to be much shorter than an hour, where we only have half an hour together, just to give you a little bit of a taster, a little bit of an introduction to what these webinars are going to be like. We have our first official launch of the webinar series next week, next Thursday evening, Europe time, lunchtime, US time, and Friday morning, Australia, New Zealand time. And next week, we're going to kick off the whole series with a webinar about the right to health, looking at what is the right to health, what is the right to health care, how does this relate to universal health coverage and health insurance, all those tricky topics which are being dealt with in many countries around the world, but particularly in the US at the moment after the repeal of Obamacare and the introduction of Trump care, if it's called that these days. So first of all, I want to begin by telling you a little bit about the Global Human Rights Group. So the Global Human Rights Group is a social enterprise. We're made up mostly of two legal entities, of the Global Human Rights Clinic, which is a not-for-profit association, and the Global Human Rights Consultants, which is a not-just-for-profit boutique consultancy firm that specializes in human rights and global advocacy. And these organizations together form the Global Human Rights Group, and we do things like train human rights defenders and human rights advocates. We run some online courses for everyday people as well as for specialists in human rights. At the moment, one of the courses which we're in the process of running for everyday people around the world is called How to Stand Up for Human Rights in the New Dystopian Era. We're just about to relaunch that in a slightly new format, so we're about to start taking new enrollments for that course, which you'll find out more about on our Facebook page if you're interested. And let me just tell you a little bit about what the Global Human Rights Clinic does, because I think this is one of the most interesting ways in which we do some really great work. With the Global Human Rights Clinic, the idea is that it's an experiential learning opportunity for law students, international relations students, human rights students, young practitioners, recent graduates, as well as more experienced practitioners, people who already have some expertise in human rights, who have some real practical knowledge and experience to share. We get these people together in teams, in small groups, rather like what would be a project group in a regular NGO, in a regular non-governmental organization. And we pick particular issues where we think we've got some kind of strategic leverage point that we can work on. So, for example, an issue where maybe there's a national election coming up and a particular issue is something which is particularly important during that election, or maybe it's something where a particular government has to report to the United Nations about an issue, and so because that doesn't happen all the time, that's a particularly timely moment for us to focus on drawing attention to that particular country or government and what's happening there. So, for example, some of the projects that we're prioritizing at the moment are some that some of you who've been following us for a while have already heard a bit about, but let me just start from the beginning for those who haven't heard us talk about it. We've got a really interesting project that we're doing globally about trying to look at repression of NGOs around the world. And we're looking at this, what you'd say thematically, to look at what is the trend of how are governments suppressing civil society, what kind of laws are they introducing to outlaw non-governmental organizations, human rights organizations in particular. And in particular, many countries where governments are introducing laws to criminalize the concept of being a human rights defender, and also human rights defenders who receive funds from what they call foreign funders. So, for example, if an NGO in country A receives funding from an NGO from a funder from a government that's another country, that's seen as foreign funding. And in many countries, more and more laws are being introduced to outlaw that kind of support for the operation of civil society and for the work of human rights defenders. So we're taking 3 to 5 countries in each geographical region for our pilot project to look at what are the laws that are being introduced in those countries, what impact does it have upon human rights organizations and human rights defenders. But then the most interesting and innovative aspect which we're adding to this, which goes beyond what other organizations are currently doing, and that is we're trying to see how we can help those NGOs with establishing other legal entities in places like Switzerland and Geneva so that they can continue their work. So that even if the government outlaws what they're doing in their own country, they still have a legal entity, they still have a non-governmental organization, a not-for-profit organization where they get tax exemption, where they can have a bank account so that they can receive the money from funders, so that they can continue their work, they can keep that institutional history alive with the work that they're doing, and they can continue to access the United Nations to share the stories about what's happening, about the human rights violations that they're witnessing, and about the work that they're doing. So we've already begun that, in a sense, of helping a number of NGOs from some countries, particularly some countries in the Middle East. And we're hoping to be able to get some funding to make it much more affordable for other NGOs to get this kind of help so that we can actually offer some subsidized assistance to other NGOs for the work that we're doing with them, with that project. That's one of my favorite projects that we're doing. One of the projects that we've been doing for a few years, and we're continuing to do it as well, is looking at conditions in immigration detention. And in this, we're looking at a few countries in particular, mostly Australia, Nauru, which is a small island country in the Pacific, as well as Papua New Guinea. And we're looking at the ways in which various different human rights are violated when governments and private contractors, so the equivalent of prison services, are employed or contracted to operate immigration detention centres, particularly for asylum seekers who are being held for long periods of time while their claims are being processed. We've got all sorts of evidence and examples of really systemic and widespread violations of the rights to health, housing, water and sanitation, food, and also sexual assaults, violations of the right to physical integrity, and a lot of mental health issues as well as physical health issues. So we've been collating a lot of information, first-hand testimonies and evidence from people being held in detention and people working with them, and presenting that to the United Nations and helping the UN to try to work with the governments involved to find ways to minimise the human rights violations that are going on, and also to find alternatives to how we can avoid these situations of human rights violations, particularly in immigration detention settings. Those are a couple of the bigger long-term projects that we're working on, and we've got some amazing people working on these, all as volunteers doing pro bono work. We would love to have some more staff able to work on that. That's what we're working on in terms of funding, is to boost our own capacity as a small NGO. At the moment, we have 3 team members. In the past, we've had up to 12 team members. Right now, we're at 3, which is wonderful. Some of the other things that we're looking at are, for example, where we have a project looking at the right to housing, in particular in developed countries like New Zealand and places like that. You may think, why are we looking at New Zealand? In fact, it's a really interesting case study because it has one of the highest rates of child poverty in the OECD countries. I think it's the second highest at the moment in terms of countries in the OECD when it comes to child poverty. How this is manifesting in reality on the ground is over the course of the last few years, there have been a number of children that have actually died because of health issues caused by the quality of the housing that they're living in. Now, this is public housing, welfare subsidized housing, rental housing. And in general, if you look at the country, if you look at the housing across the board, whether it's state-funded housing or private, low-cost affordable rental housing, what we call the quality of the housing stock is so substandard that it's causing many physical illnesses in many of the residents, which in a country that's developed, that has numerous resources, which has an economy which is functioning without too many problems, we think this kind of thing just shouldn't be happening. And as I said at the beginning, what we try to do is look for opportune moments to intervene or to help to make recommendations about how the human rights situation can be improved. It's coming up to election time in New Zealand. There's a government election happening for the country, national election. And so what we're doing is doing some research and collecting some information about the situation when it comes to the right to housing, and looking at what recommendations can we put forward to the government that is being elected, and how can we take what we call the human rights-based approach, a human rights framework, and help to reframe housing policy in that country according to a human rights framework. And this brings me to the point about what we do when it comes to the right to health as well. So in the first of our webinars proper that we're going to do next week, we're going to have an hour-long discussion about the right to health and the right to health globally, but in particular, we're going to look at the right to health in countries where we rely on insurance as part of the healthcare system. So looking at this idea of universal coverage and health insurance programs, and what do they mean in terms of the right to health? How do they actually help? And what do we mean when we talk about a human rights-based approach to health? So for example, with the current debate going on in the US, what's the added value of talking about a right to health perspective? When we talk about health and healthcare, obviously it's an issue, it's something that concerns us. And we've seen the outrage over the course of the last few days when it comes to issues to do with the preconditions that people have, or pre-existing conditions that people have, the way in which women in particular are being treated under the new healthcare legislation that's been put in place in the US. But why does it help us to look at this with a human rights perspective, and what does this actually mean? So we're going to look at kind of unpacking this idea of what is the right to health, what does it mean, and what are the implications for our healthcare system? What does it mean to have a healthcare system that is compliant with human rights? And we're also going to have a look at how can we use this concept of a human rights-based approach to health, so the right to health, how can we use this in our advocacy, in our resistance? Why and how does it help to use the terminology of human rights? And is this something which could be useful for us when we go about our advocacy? So in order to look at that, we need to understand what do we mean, and then think about how can we use this in our work in resisting all the different aspects that are problematic about the current healthcare legislation that's been introduced in places like the US. So, for example, a lot of the questions that people raise when they're talking about, should we get rid of the Affordable Care Act in the US and things, are some people talk about, well, where does it end? If we have to provide healthcare and health insurance at an affordable rate for everybody in society, where do you draw the line? And what happens if we can't afford it? What impact will this have upon the economy? How can we afford to provide affordable healthcare for everybody who needs it? And one of these misperceptions about what the right to health means is that this will open the floodgates to all sorts of claims from anyone about any kind of health, and that this, if we're looking at a human rights perspective, we're somehow talking about a right to be healthy and to make everybody healthy. And that's not what we're talking about when we're looking at a right to health perspective. So we're going to unpack that a bit next week and answer all of your questions about the right to health. And that is the point of these discussion hours, is to look at a topical issue, which may be something that's of use to you in your world, in your day-to-day life, in the advocacy that you're doing, and figure out how can we understand it from a human rights perspective, what are the human rights aspects and implications, so then you're a little bit better informed to use human rights in your everyday life. And to do that kind of thing, I rely on questions from you. So I would love to hear from any of you about questions you have about these topics, or about issues you'd like me to cover. What kind of topics would you like to hear me talk about when we're doing these webinars? Are there particular topics you want us to address? I'd love to hear your suggestions. You can post them on the Facebook page for the Global Human Rights Group. You can send them to me privately at my Facebook account, Claire Mann, or you can get in touch with me in any of the other ways that I'm sure many of those watching know how. And I would love to hear from you about what kind of issues you would like to talk to us about. And I'd love for you to join us Thursdays. We're going to talk, have our discussion hours on the third Thursday of every month. So we begin proper next Thursday, Thursday the 18th of May. Sorry that I got the date wrong in the graphic that I used, but I'm going to fix that. So it's 1 week from today. I've tried to make the time so that it fits with as close as possible to a convenient time for everybody in every time zone. But because we have followers from all around the world, I know that's going to be very difficult to find the right time. So the videos will be recorded and you can come back and have a look at them anytime you want. I'm going to give you a little bit of an introduction also, since I see we don't have any burning questions yet, which I'm hoping is a good thing. I hope that means that everybody's following and enjoying and not coming up with major burning questions yet. And I'm hoping that next week, when we actually start to get into the nitty-gritty of the discussions, will be when you have some more questions. So let me just tell you a bit about another session we're going to have, which again is kind of out of order. We're going to have it in 2 weeks' time, again on the Thursday evening. It's going to be an introduction, but at a different time, earlier than we normally would. So I'll be sending out the announcement about that as soon as I can. And let me just see, there's been another comment here that I want to make sure that I'm catching all the comments. It's a bit hard to get them all on the different devices I've got going on here at the one time. But let me see if I can get what that comment is. Let's see. Catching all the comments. Okay. I think that comment I'm not going to be able to get, but anyway, I'll catch it afterwards and I'll answer any questions people have afterwards in the comments. I wanted to tell you a little bit about, in 2 weeks' time, we're going to have an introductory session to tell you a bit about what we're covering in the course on how to stand up for human rights in the new dystopian era. Sorry about that feedback. That comment. I hope that this doesn't come through too much, with too much feedback. All right, let's get rid of that tab. Okay. Now, the course on how to stand up for human rights, we're covering some really practical things. And as I said, we've already started it, but we're going to restart and do it in a different format, where I'm going to do more live calls and videos with people so that we can get more engaged in the substance of it. But the course begins with an overview about what are human rights and why do they matter, and what does it mean to be a human rights defender, and what do we really mean by human rights. So if we're talking about the right to health, does it mean that everybody has the right to be healthy? Does it mean that everybody has the right to a kidney transplant if they need it, or a heart transplant? Or to what extent do we say a human right to health means everybody must be entitled to everything that they need health-wise? And just a little foreshadowing handy hint, it doesn't mean that everybody's entitled to everything. So we're going to look at what that really is. But the main crux of the How to Stand Up for Human Rights course is to look at a number of steps, which I like to think of as being the main steps that we need when we're thinking about human rights advocacy. So we look at thinking about how do we inform and educate and communicate and listen? How do we, instead of really trying to speak on behalf of those who are voiceless, how do we sit back and listen to people who really actually are not so voiceless if we just shut up and let them talk? And how do we communicate, particularly in situations where it's really difficult to communicate with people who have different viewpoints to what we do? And I know you've all had those situations at family dinners or things like that, where you're sitting with people whose opinions are really fundamentally different to your own. And sometimes it feels like it's difficult to even broach the topics or to do so without the anger and frustration that often comes up. So that's kind of the action step one, is thinking about how to inform and communicate and educate and listen in ways that are healthy and useful and are actually going to further our cause, rather than have people dig their heels into their already established positions. The second action step that I like to talk about, and that we're going to look at in the call in a couple of weeks, and then in more detail in the course, How to Stand Up for Human Rights, is about how to influence decision makers. Now, as human rights advocates, in order to advocate for the human rights issues that we want to progress, what we're usually thinking about is, how do we change policies or laws, or how do we change the government's allocation of resources, for example, through the way that the government budgets? And in order to have some influence over those things, we need to identify who are the relevant decision makers and how do we approach them? How do we try to make change when it comes to influencing these decision makers? And that's a really key point. It's something that a lot of you in the resist movement in the US have been encountering, perhaps for the first time or for the first time in a while, about calling your senators and writing letters and doing petitions and things, attending protests. But it's a lot more than that as well. There are other ways also. So looking at the wide variety of ways that we can all work together to influence decision makers. The action step 3 that I like to think about and that we'll talk about is then about leadership through activism. And that doesn't mean that everybody has to be a leader. When we come to the human rights movement and we come to activism and defending human rights, not everybody is meant to be a leader. Everybody has their own role to play. And so it's about identifying for each of us individually, what is our role to play in the resistance? What role do we want to play as human rights defenders? Where are our talents best used? What skills do we have that we can utilize for human rights advocacy in order to really make a change? And in the course that we're doing, How to Stand Up for Human Rights, we're going to do some really practical exercises to help identify and make a personal action plan, which is going to be a personal plan where we've identified where we individually are best off using our skills and our time and our energy in terms of leadership through activism at a personal level. We then, in the course, look at a little bit about using the human rights mechanisms that exist and using legal remedies, because human rights is actually a legal system. So understanding what human rights are in terms of the legal system is useful, but then we also need to know what are the forums we can go to and how can we access those? How can we use those? One of the really interesting things that I find in training and teaching really specialist lawyers and human rights advocates is that they often don't know what the human rights mechanisms are that they can use. So it's no wonder that the average man on the street doesn't know if experienced human rights advocates don't really understand just how easy it is to use some of these mechanisms to enforce human rights obligations. And they really are. Some of them are really easy to use. And as everyday people, we can use them. We don't have to be lawyers or specialists to use them. So we're going to look at some of those. And then we're going to have a look, finally, at donating to human rights defenders. How do we make informed decisions about where to send our money? If we've decided that one of the ways that we individually can contribute to the human rights movement is financially through working in the jobs that we work in and then using some of our salary to support the activism work of other people, how do we make decisions about who's the best recipient of that money? Where do we want to send that money to? So kind of breaking down some criteria for analysing organisations and the work they do according to our criteria for what it is that we want to support, and how can we analyze that kind of thing. So those are some of the things that we're going to be covering in the How to Stand Up for Human Rights course. We're also going to have a little bit of a look at self-care, that kind of thing you've heard over and over and that we address in so many different areas of life. Self-care, it's particularly important in the activist movement when we're thinking about resisting. It's a long road, you know, as we're seeing in the US, this idea of we need to resist Trump. It's not a case of doing it for the first month after the inauguration. It could be a 4-year-long process, but whatever happens, it's going to be a long process to overcome some of the damage that's been done, not just to get rid of the administration that we perhaps think is violating human rights, but to make sure that the society gets built back up again in a way that is human rights friendly. This is things we have to be in it for the long haul. So how do we look after ourselves in that process? And how do we keep safe? As human rights defenders, no matter what level of activism we are, whether it's working in our communities, contacting our senators, or if it's being much more actively involved at a national or international level as a leader of the human rights movement, we need to think about safety. How do we do that? Is it about using encrypted emails? Is it about being careful when we travel with our phones? You know, what are the things that we need to do to think about safety as human rights defenders? And then finally in the course, besides from some open Ask Me Anything question and answer sessions, we're going to have a little bit of a bonus session about using humour in human rights. I personally think that the use of humour is something which is essential as part of self-care, but also just generally as part of human rights activism. It's a great tool for activism. It's also a great relief when you're doing activism. So we're going to have a little bit of a look at how, when you're standing up for human rights, how you can use humour for you personally as well as for your movement. So that's what we're going to cover in the How to Stand Up for Human Rights course. We've got, we're going to go into a little bit more detail into some of those things in a webinar that we do in 2 weeks' time. If you'd like to join us, the information will be on our Facebook group, on our Facebook page, sorry, the Global Human Rights Group Facebook page. Next week, we're going to get stuck into our very first Global Human Rights Group discussion hours on the right to health, looking at the right to health, the implications for healthcare, and issues such as universal health coverage and health insurance, and what these things mean through the framework of human rights, and in particular, the right to health. I'm really looking forward to having your questions and your engaged involvement in that webinar next week. And then every month from then on the third Thursday of every month, when we look at other human rights topics. And I'd love your suggestions as to what topics to cover and to address. If you have any ideas or any questions, don't hesitate to get in touch. And I'll just see if there are any last minute questions or anything. I said we only wanted to go for half an hour today. I don't want to take up too much of your time, since this is just an introduction, a bit of a taster, a bit of a test of our technology. And we'll see you hopefully next week for the first seminar. Thanks, Gloria. I see your comment. Great to have you on here. I really appreciate your presence, and I'm glad to see that we can get comments come through on Crowdcast. Good to see that. And I think we've got some more comments on Facebook as well, which I'll get back to after this session. So that's going to be it for me. Thank you so much for watching, and I'll see you next time.